Welcome, everyone. My name is Dr. Anthony Nguyen. I am one of the GP doctor based at the Montfort Surgery, which provides student healthcare for the Montfort University students. Today, I'm going to talk to you about the National Health Service and understanding what the National Health Service involves and what you need to do to be registered with a doctor and access to the health service. Can I have the first slide, please? So in summary, what I'm trying to do is to give you an understanding what the National Health Service, give you an idea of what are GP. GPs stand for general practitioners, which is in other countries, it might be called a family doctor or a family physician, etc. Okay, and what to do if you are ill, and ask yourself the question: do you need to see a doctor or not? Okay, so next slide, please, Mark. And just a very topical issue at the moment about COVID. You all probably know what it is. What symptoms of COVID? How to test for COVID? Some public health and prevention measures, and a little overview about the vaccination program that's running in this country. Next slide, please. So the National Health Service was first founded in 1948, just after the Second World War. Basically, the ethos of the program was basically it's a free service at the point of contact. So there is no charge to access or see a doctor, whether it's GP or hospital doctor at all. However, obviously, if you need treatment, certain group of people will need to pay for the cost of prescription, but there's also a group of people who will be excluded from paying for prescription costs. These groups of people are things like people who has diabetes, who are taking medication for diabetes, other groups are epileptics, who are on medication, people who have got underactive thyroid or are taking thyroid hormones. They will get free prescription and free treatment as well. So overall, the majority of the care is provided solely by the GP based in the community. So here at the Montfort University, the Montfort Surgery is based right within the campus, and we have GPs and we have nurses, mental health worker, physiotherapy to provide general health care for you. Okay, so the healthcare can be accessed, only can be accessed if you're registered with a GP. So if you're not registered with us, we don't have you on the system, we can't see you as a patient. So you must register with a GP, and I'll explain to you how to register with a GP at a later slides. Okay, so next, please. So what are GPs? GPs, like I said earlier, GPs stand for general practitioners. Some people known as family doctors. Some other countries call them primary care physicians. Okay, so as doctors, we undergoing sort of 5 years of undergraduate training, and then after that we do another 5-year postgraduate training before we are accredited with being a GP. And so we will have postgraduate qualifications with that. So a GP covers all aspects of physical and mental health problems. Some GP will have some special interests, and I will talk to you a bit about that later. And so you might want to pick a particular GP with a particular special interest if you want to discuss in depth about a certain problems. Okay, so the role of a GP in the National Health Service is acts as a gatekeepers so that if you need secondary care, which you need specialist care, then if we are the gatekeeper to try to find out if it's appropriate for you to be seen in secondary care. And so if it is, then we refer you to secondary care, which is based at the hospitals. Okay. Next slide, please. So first thing is what to do if you are ill. So I think being practical, being sensible is the right thing. Basically, be prepared. So make sure you keep common medicines at home with you, just in case you become ill. You can get these common medication without a prescription. You can buy that at supermarket or pharmacy. These common medicines are paracetamol, that is usually used for pain treatment, or if you've got a fever, you can use that. Ibuprofen is an anti-inflammatory. You can use that for pain and fever as well. Some people use soluble aspirin for sore throat. You can keep that in your kind of like a medicine box if you want to. I would recommend to also to have some we'll put antacid, which is basically over-the-counter medication you can buy to treat for acid indigestion type symptoms. And then other things are minor injuries, such as you should have some sort of plasters for if you've got cuts and grazes as well. Next slide, please. So do you need to see a doctor? So what we encourage people to do is basically to self-care. But if you need to see a doctor, yes, you do. But so if you've got ongoing chronic conditions such as asthma, epilepsy, and you need to see a doctor, because we need to review and to manage your medication, then definitely you need to see. I mean, usually with those, we need to see you at least once a year. You do need to see a doctor if you've got an existing conditions and you have to take regular medication. And so we have to, when you register with us, we have to put these regular medication on repeat prescription at our surgery. Okay. You probably need to see us if you need to have update on vaccination. So, for example, in this country, we, under 18 or students entering their first year, they usually get their meningitis vaccination done at their doctors at home. But if they forgot to do it, so they come to us and we'll give them the vaccination to protect you against meningitis. Obviously, it's a serious condition. So obviously, you don't want to get it. So it's worthwhile to have the vaccination done and get it up to date. However, most cough, cold, sore throats, or flu-like illnesses, these are viral infections. So they are generally self-limiting. That means they settle down by itself, and you just have to self-treat yourself at home. So therefore, you don't need to see a doctor. However, if the condition deteriorates or worsen, there might be some underlying secondary infection. So you do need, if you feel really ill, you do need to get some clinical input. And you can access that you can ask advice through a pharmacist. They can give you advice that you can get remedies that they can give it to you. But if they suggest that if they can't help you, then they might say you probably need to call the GP to get just sort of like an appointment to manage their illness for you. Okay, so bear in mind a viral illness, it cannot be treated with antibiotic. The word antibiotic means against bacteria. So if you've got a bacterial infection, then it is appropriate to see a GP so that you need to be prescribed some antibiotic to treat it. Okay, next slide, please. I don't know what's wrong with this slide. Okay, so recently, obviously, everyone probably heard there is a worldwide pandemic going on. And so I just want to give you an overview of what what is COVID. So COVID is a coronavirus. Obviously, the word COVID-19 means coronavirus, and I think it was discovered in December 2019, and that's why it's called COVID-19. Okay, so the three main symptoms of COVID are high temperature. This means that you feel hot to touch. It's on your chest or your back. But you don't need to have a thermometer, but it'd be nice to have a thermometer, I suppose. A new continuous cough. Okay, so this means a coughing that's a lot more than an hour, or 3 or more coughing episodes in a 24-hour period. So if you have a cough, it may be worse, or if you have a cough normally, but it's worse than normal, it's probably worthwhile check that out for possible COVID. And then finally, a loss or change to your sense of smell or taste. So this means you don't notice, you cannot smell or taste anything, or things smell a bit different to normal. Okay. Next slide, please. There are other symptoms that might suggest it's COVID. So you don't have to have all 3 of those symptoms. You could have one of those symptoms, and but you might not have any of those symptoms, but you have these other symptoms such as shortness of breath, difficult breathing, tiredness, muscle, general body ache, headache, sore throat, runny nose, feeling sick, vomiting, having sort of diarrhea. So these are kind of like typical viral illnesses, but obviously with this current pandemic, it could be a COVID symptom. So it's worth checking it out and get advice. Okay. Next slide, please. So what do you do if you have symptoms? Okay. So if you have any of the main symptoms, that even if they're mild, then the current government guidelines suggest that you have to go and get a PCR test, which is PCR stands for pulmonary chain reaction test. Okay, so this is the gold standard to determine whether you got COVID or not. Okay, and so you can call up, and basically I think you can log on to the government website, and you can book an appointment, or they can send you a kit to test, and you have to post it back to them. Okay, so stay at home and do not have visitors around, because obviously you can spread the virus. Okay, until you get your test results back. Okay, and like I say, only leave if you have to go out to do the test itself. Okay, people who live with you also need to self-isolate. Might be they have to have testing themselves as well. Okay, next slide, please. So if you have any of the 3 symptoms, even mild, please order a PCR test as soon as possible. You can order it through the government website. Test it will be sent to your home, or you can book an appointment at a walk-in or drive-through test site. Recent kind of updates on that is that they don't recommend you to use this service if you have been tested for COVID positive in the last 90 days. So don't do this test again, because it will likely come back as positive again. Okay, unless you develop any new symptoms. All right, next one. So there is a drive in this country also to get the PCR test, and even if you have no symptoms. So the kind of list of criteria where you can have the PCR test done even if you have no symptoms. So basically, if you've been in contact with someone who tested positive, you've been asked by the test and trace to get it done, because you might have been in close contact with someone. Maybe you're on a trial, as there's a government project, a pilot trial, then by all means do it. You've maybe been called, you had some viral illness, but you call the GP, and we advise you to go and get the test done, because sometimes we have to assess that this potentially could be COVID as well. Okay. Or it could be just a national response. You will hear in the news that people like every week the politician will say you have to go out and get the test done. But at the moment, it's mainly for if you've got symptoms or you've been asked to have it done by GPs. Okay, next one, please. There is another test that you can do. It's called lateral flow test, and you can order this lateral flow test through the government website. I would say to you, and you should do it whether you're symptomatic or not. A lateral flow test that is positive, then you definitely have to go ahead and do a PCR test. If a lateral flow test is negative, well, it's reassuring. But if you are symptomatic, if you've got symptoms, I would not rely on the test to say because it's negative, it means you don't have COVID. I would actually get clinical advice, and you might have to go ahead and do a PCR test. Okay. Next one, please. So this is related to COVID again, when to seek urgent medical attention. Very important. If you have trouble breathing, you have persistent pain or pressure in the chest, you feel new confusion, unability to stay awake, you look pale, your color looks blue, your lips and nails also look changing color into a bluish color. These are symptoms that might suggest you got septicemia, which is blood poisoning. So definitely need to seek urgent medical attention, please. Next slide, please. Prevention measures. Like I said, most people in this country now have their vaccination, but the infection is still quite prevalent. So, and obviously the lockdown has been lifted, and now certain measures are being sort of like given as voluntary. But I would recommend that if you are going into a building, a public places like a supermarket, to university, I would wear a mask just to give yourself protection. Try to keep your distance and wash your hands as much as possible whenever you can, and if possible, have good ventilation. And these measures will help sort of prevent the spread of COVID. Okay, next slide, please. So at the moment, there is a national vaccination program. So everyone over the age of 12 or older are eligible for COVID vaccination now. In this country, there are 3 COVID vaccines that have been approved. There is a 4th one that will be approved sometime later this year, called the Janssen. I think in America it's called Johnson & Johnson, but in Europe it's called Janssen. Okay, next slide, please. So most of you are probably 18 or over. Okay, so you will be offered 2 doses. You can book the vaccination online through the NHS UK website. Nowadays, in recent weeks, pharmacy are started to begin to offer vaccination as well. So you can go to a pharmacy and get the vaccination. But when you are going there, they do need to require your NHS number, so they need to know whether you had the vaccination already, so that we don't have any error in giving the wrong vaccination, etc. Okay, so the other option is wait until you're invited to go to your local NHS service to get the vaccination. Most people over 18 has been invited already. Okay, next slide, please. If some of you are the age between 16 and 17, you will get your first dose, or get invited to get your first dose. It can be done at the local NHS service, and the appointment cannot be booked online though. because I think we have to do some verification, and unless you're going to turn 18 in the next 3 months, then you can just go to the local NHS service and get the vaccination done. Okay, next one, please. So all children between the age of 12 and 15 will be offered their first dose. Obviously, parents have to consent to that. It's offered, it's not mandatory. The word's offer. Okay. Some children will be given 2 doses if they are high risk or they live in a household that's high risk. Okay, next slide, please. Also, just update you, there will be a booster vaccine that started rolling out just this week. It will be on a tier system. So at the moment, it will be people over the age of 80, people working the front line, such as care workers, so healthcare workers, or people working care homes. Okay, but eventually we will go down that tier, and people will offer the booster vaccine. Okay, next slide. Next slide, please, Mark. So some of you are from overseas, obviously. You might have your vaccination already done in your country. So if you are and you need a second dose, please register and come to us, and we will arrange for you to have your second dose here. If you haven't had your vaccination overseas, get registered and you'll be eligible to have the vaccination. Okay. And I know that some of you might be having come along with your family. So if your partners or your children, they will also be entitled if they fall into that age group. Okay. Next one. I explained it earlier. Basically, if an international, if they receive first dose overseas already, like I said, we will be happy to give you your second dose. It might be a dose. We don't have, like I said earlier, we have free vaccines that are approved in this country. So if your vaccine is not the same as those 3, we will find the most equivalent. So please contact us. Let us know what vaccine you had, so that we will find what the appropriate one for you to be given as a second dose here. Okay, next one, please. Just a touch on this is the healthcare talk. It is recommended that you also should be registered with a dentist. So dental care in this country is also free. However, basically, it's a very basic service, but there's a lot of aspects of dental care you probably have to pay. So you can find out how to register with a dentist by going through the NHS Choice website and then register with a dentist there. Okay, next slide, please. Emergency care. So emergency care is based at the accident emergency department, which is in Leicester. Will be based at the Leicester Royal Infirmary. There's also other sort of like urgent care centres. At the moment, the urgent care centre is based at Loughborough, which is another town about, I don't know, 15 miles away north of Leicester. That is open 24 hours, 7 days a week. Now we do have another urgent care centre based in Oby, which is on the kind of suburb of Leicester, on the south of Leicester. That is open between the hours of sort of like 8 o'clock to about 8 o'clock in the morning to 8 o'clock in the evening, sometime extending to 9 o'clock. Okay. There is also hubs, which is basically can provide extra medical sort of service when there's no more appointments available at the GP surgeries, and these hubs are by appointments only. Okay, next slide, please. So if you need advice, you can call the number 111, and that is available 24 hours a day, 7 days a week, and there'll be someone there to give you medical advice. NHS 111 is also available online as well, and who can provide that for you. So other advice, the source of advice can be from a pharmacist who are trained in advice in dealing with minor illnesses. They usually open during normal hours, and some pharmacies open sort of late hours into evening, and even some places there are pharmacies open all through the nights as well. Okay. Obviously, you can use online resources. So the NHS has the NHS website. We can give you advice about common conditions, and you can read about how to self-care, or if you need to have advise you to seek medical, then you can call and book an appointment to discuss your query. Okay, so you can make an appointment at also at the surgery to see a nurse practitioner who also able and qualified to deal with minor illnesses. They can also prescribe to you as well. Okay. We also at our practice have a mental health practitioner who can deal with sort of mental health issues. And I think at the Montfort University also have mental health support service as well. So you can access sort of mental health support through the university as well. Next slide, please. At our practice, we also provide contraception and sexual health. So contraception is free in this country. There are many forms of contraceptions available. I think you have to discuss with us, and we will find an individualized treatment that best suits you the best. Okay, we provide emergency contraception, and we advise you to see us if you need emergency contraception, be seen as quick as possible, but make sure it's up to 5 days. Otherwise, it gets very complicated, and you have to go to a special clinic, and they have to put a coil in, etc. Okay, so also there's sexual health and contraception can also be provided and accessed through the Leicester Sexual Health Clinic, which is based at the Leicester, the Haymarket shopping centre in the town centre. You can access it through online, or you can call them on the number on the screen here. Okay, next slide, please. So mental health is very important in the student sort of community, basically. So your mental health, emotional health is very important, as well as physical health. We see common conditions like anxiety, depression. So the symptoms, you can have things like low mood, poor, not sleeping properly, not concentrate, not able to do your work properly. You might have loss of appetite. You might feel worrying excessively. So if you got these symptoms, it could be a mental health problem. So maybe worthwhile get some help and support for that. Okay. So like I said earlier, university counselling is available, or you can access through the Montfort Surgery as well. Next slide, please. So the Montfort Surgery. So we are based on the campus. So right at the end of the campus to where Grasmere Street meets Mill Street. Okay, so we specialize in student healthcare, and we work closely with the university to provide healthcare for both physical and mental health for you. Next slide, please. So I'm one of the doctors there. So there's quite a lot of doctors there. Not all. I'm classified as full time. However, I only work. I only the base at the surgery 3 days a week. The other days I got other commitments at like a care home and things like that. So so I just highlight the doctors that are listed are working at our surgery and their sex as well. Next slide, please. So earlier I said that some GPs have special interests. So for example, my colleague, Dr. Heaton, he has special interest in sports medicine or orthopedics. So if you got like a musculoskeletal injury, you play sports and you fell over, you sprained something, obviously he's the best person to deal with that. But in theory, you can, if it's minor, any GP can see you and deal with that. Okay, but if it's complex, then it might be he's the best person. As for myself, I sort of specialize in chronic diseases. So things like if you've got diabetes, probably doesn't apply to you guys out there, especially in elderly medicine. I go once a week to a care home to do a clinic at the care home. I also had 3-year training in pediatric, which is looking after young children. And I also do minor surgery as well. My other colleague, Dr. Basu, he specialized in mental health and also drug and alcohol problems. We got GP Dr. Ahmed, who specialized in skin problem. Dr. Nainan is specialized in sort of ear, nose, and throat, and sexual health and contraception issues. And Dr. Sultana has a special interest in gynecology. But Dr. Sultana is away on maternity leave at the moment. She'll probably be back in the early 2022. Next slide, please. So we got other clinician based at the surgery. We got Sarah Allen, she's a nurse. Sarah Wharton, she's a mental health nurse. We got Ankita Chauhan, she's a healthcare assistant. So she basically do chronic health checks for me to save me time and things like that. So she does blood tests, blood pressure, all these other things, ear syringing, all those things. Homa Nagdali, she takes bloods for me. And then we paid for a chiropractor called Neil Painter to come in to help with sort of like a sort of musculoskeletal work as well. And we got physiotherapists who come and do sessions at our surgery for kind of like sort of like musculoskeletal problems. Next slide, please. These are not attached to our service, but they sometimes visit our surgery to provide clinics. So things like smoke cessation counselors, so help you to stop smoking or promote stop smoking. Health visitors are nurses who look after young children, usually from the age of 1 to 5, but they do cover it up to so the age of 16. However, between 5 and 16, usually they liaise and talk with the school nurse who deals with those things. Okay. And we got mental health counselors who come into the surgery as well. And we got midwife. If you're pregnant, you can basically inform us, and then you'll get booked with the midwife. Okay, next slide, please. So how to make appointments? So first thing is you have to be registered and have an NHS number to belong to be part of the surgery, and then you can make appointment through that surgery. You can only be registered one surgery. You cannot have multiple registration at different surgery. Okay. To make an appointment, if you're happy to see any doctors or nurses, you can telephone the surgery 0116 222 7272 between 8 a.m. Onwards. We usually work between 8 a.m. to 6:30 p.m. Monday to Friday. Okay. If you want a specific person, you can ask to book for that specific person in advance, or you can find out what day that person's in, and you can just ring on that day. Okay. Next slide, please. So, like I said earlier, if all the appointments at the surgery are gone, we might direct you to extended hour hubs. So there will be GPs and nurses there who they have access to your medical record, and they can provide sort of health advice and treatment for you as well. Okay. Obviously, if it's urgent, then you will need maybe the on-call doctor will need to talk to you, triage, and then assess whether you need to see her face-to-face and give you treatment straight away on that day. Okay. So just finally, said during office hours, please speak to the duty doctor for kind of like any query. Do not go to the emergency department, because the emergency department is completely sort of swamped. I mean, full of people, sort of like, because they can't get an appointment. They see that they can go to there, but it's only for accident or emergency. So Emergency means unless it's life-threatening, then you should be going to accident emergency department. Okay, next slide. So when outside of core hours, so our core hours are between 8 a.m. to 6:30 Monday to Friday. Outside of that hour, there will be an extended sort of like service available. If you need to access sort of clinical support, just call 111 and they will direct you. You can have an appointment, you can have a telephone conversation. If they think it's urgent, they will send an ambulance or they tell you to go down to A&E. Okay. And like I said earlier, there's urgent care center based at Loughborough, open 24 hours a day, 7 days a week. The OB urgent care center is open sort of like 8 a.m. to 8 p.m. Monday to Friday, at some 8 a.m. to 9 p.m. Monday to Friday, and 8 a.m. to 8 p.m. At the weekend. Next slide, please. So what do you need to do now? So if you are in the UK now, I would recommend that you need to register with the GP practice, whether it is our practice or another practice. To register with our practice, our website is there, the montfortsurgery.co.uk. There will be a registration form there for you to fill in. And once you fill that in, one of our team will contact you and let you know that you are fully registered on the system. Once you're registered with the system, then you can then book an appointment with a doctor or nurse or any other healthcare professional. Okay, it is free to register. Okay. And obviously, it saves you time if you register in advance rather than you become ill and then you have to go and register. You might not be in a fit state to get all the information to fill in. So it's a good idea to do it in advance, registered with a doctor. You get access to free healthcare. And so if you need help, it is there for you. Okay. And once you're fully registered, then we'll send the information to the NHS and they will send you an NHS card. So the NHS will have in it your information, your date of birth, your name, your address, and they will give you an NHS number. So it's a unique number to you. I think that's a 10-digit number that's there. Okay. Next one, please. And finally, basically, there's additional thing in this country. We when you register with us, we will ask questions on it about data sharing. So you can sign into it, so as you can consent for your sharing. I recommend you to do it. The reason why is that if you have to go to the emergency department, the emergency department can see your kind of health information. Like, for example, what medication you're taking, if you've got an allergy. So if they need to treat you, they sort of like treat you appropriately. So they won't give you the wrong medication that can cause you an allergic reaction or something like that. Because sometimes when you're at the emergency department, you might be too confused. You can't remember that you are taking this medication, you're allergic to this thing. So it is worthwhile having to share your data. It's only shared within the NHS. It will not be shared with other people like Google or other multinational sort of technology company at all. Okay, and that's the end of my talk. Have you got any questions? Okay. I think at this point, I think I have to hand over to Daljit, who will give the next part of the talk. Okay.
Thank you, Dr. Engwin. Thank you very much for all that information with regards to the NHS and the services that are available to the international students. My name is Daljit Kaur. I'm the site manager for the COVID testing site at the university. So what I'm going to do now, conscious of time obviously, so I'm going to try and give you a little bit more information in terms of the precautions that the university is taking in order to ensure that the DMU community is kept safe the DMU community being yourselves. So what we actually run here is what we call a test, trace, report and support program, and all this information should have been sent to you via email or on some of your comms, and it's all readily available in the DMU safety section of the DMU website, so you should all have access to that. So I probably will revisit a fair few things that Dr. Engwin actually mentioned, but I will sort of like apply it in terms of how it works at the university, and what your role is and how we can assist you with that. So with testing, as Dr. Engwin explains, there's two types of testing. There's tests for the symptomatic, which is where you have symptoms, and for that you would need to have a PCR test done. Again, if you follow the links on the DMU safety website, it will provide you with details of how you can get that test arranged. It will lead you to the government website, and it will provide you information in terms of what you need to do to isolate, etc. What we also run here at the De Montfort University is an asymptomatic testing site. So this is where you have no symptoms, and it's what Dr. Engwin mentioned a few moments ago. It's a lateral flow test. So with this one, again, there's two types of asymptomatic testing that we have available. We have a face-to-face, and we also have home testing kits. So if you would like to have a face-to-face test done, then we are based at the Eric Wood building, which is right next door to the Kimberlin Library. The operating hours are Monday to Friday between 9 a.m. and 4:20 p.m. and you can book in a slot to have a test done via the MyDMU app. Alternatively, if you are comfortable with doing the home testing kits, these are also available for collection at the Eric Wood building. We will also have them available around key locations throughout the university over the next week or so, and just keep an eye open on your comms, etc., and we should be able to disclose those locations for you. They are also available for you to order online, again via the government website. And I believe that lots of local pharmacies will also have those, so you can just walk in and they will provide you with some of the kits. In terms of what the expectation then is for you to, as you are coming to the university as a student, what the university is requesting is that you have 2 tests a week, the first and second test being 3 days apart. So as soon as you arrive at the university, we would ask that you have 2 tests in that first week, at least 3 days apart. And this is even if you are fully vaccinated, because please remember, the vaccination doesn't mean that you are immune to COVID. It just means potentially that your symptoms will be less. You can still carry and transmit. So in order to try and reduce transmission, we would still ask that those that are fully vaccinated do also come and visit us and have the test done. So a reminder, these tests are for those people with no symptoms. So on arrival at the university, take 2 LFD tests 3 to 4 days apart, either using the home test kit or using our on-site testing facility. You should then test twice a week throughout September and until further notice. So at the moment, we are likely to be here up until Christmas. So the expectation would be for you to continue to get tested or using one of those methods. When you do book in, if you want to come and have a face-to-face test done, then on arrival, please bring your student ID with you. You will also need your phone to register your test, and we still encourage that you do wear a face covering if you can do so. Little bit of information about the home test kits then. There are 7 kits in a box, so that should last you about 3 weeks, and all the instructions are contained within the box with regards to how to report and register the actual test itself. By registering the tests, be it at the test site or at home test kit, the NHS will send you the results directly. So we don't actually send you the results. The results are actually sent to you directly by the NHS team. Now, once you have completed one of the LFD tests, there's going to be 3 possible outcomes. One is that you're going to get a negative test result, which means that at the time that you tested, you were not displaying any symptoms and you were not carrying the virus for COVID. In that situation, what we would ask you to do is continue to test twice a week following that. If you receive a void test result, then what we would ask you to do is to revisit the test site and to undertake another test, or alternatively, retake another test at home and upload your results. If, however, you receive a positive test result, then you would need to report this as a positive result and you would need to self-isolate. You will be contacted by the NHS and they will provide you with further guidance and further instructions. Now, our Safe Trace team does work with the NHS. So what we would ask you to do is that you also complete and submit a self-isolation web form to the DMU Safe Trace team. Again, all of these details can be found on the DMU Safety website. The DMU Safe Trace team are there to help and support you through your isolation period. The Safe Trace team will also help trace DMU close contacts to avoid transmission within the DMU community. And the team can identify potential outbreaks within the DMU community and put measures in place to reduce the impact. So it's really important that you do contact them and let them know where you have had a positive result. Reporting also triggers a deep clean of learning and teaching areas which may have been affected. And the team can track potential DMU close contacts and request they self-isolate, reducing the risk of transmission. Reporting keeps the wider university community safe despite ongoing restrictions. So if you have any questions with regards to the Safe Trace team, then what I would ask you to do is to email DMU Safe Trace, that's all one word, at dmu.ac.uk. Now, really on a final note, despite lockdown restrictions being lifted, students are asked to be considerate in use of physical study spaces and, like other DMU campus buildings, are encouraged to take personal responsibility for keeping others safe, including continued social distancing and wearing of face coverings in communal spaces. Continue to wash hands regularly and to use sanitizers, which is located all around the building. So literally we have sanitization points dotted all over the buildings. Please, use those as much as you can really, and continue to wash your hands as often as you can also. Dr. Engwin also mentioned the vaccination side of things. Now, the university is going to be running a pop-up vaccination clinic, and further news and information will be delivered to you probably via the comms, etc. So if you are still looking to get vaccinated, then that information should be made available to you very soon. I know we've only got 1 minute left, so if anybody does have any questions, I know that I've had to rush through that part of mine, but please feel free to email me at dmusafetrace@dmu.ac.uk. And what I will do is I will put the email address in the comments section so you can provide, you've got details of that without having to note it down separately. Thank you very much for your time.